Good afternoon. I'm El Gloria Harrison, Dean of Lehman College School of Health Science, Human Services, and Nursing. On behalf of the college and the Office of the President, I'd like to welcome you to today's forum. It's the start of an important campaign, Lehman Gets the Vax, that we hope will go a long way in dispelling fears about the COVID-19 vaccine and giving the Lehman College community and the broader Bronx community resources that they can use to make the best decision for their health amid this pandemic. We know that's a lot at stake here. Since the start of the pandemic, scholars, activists, and journalists have noted that long-standing health and economic disparities leave many communities of color vulnerable to the COVID-19. Indeed, when the New York Times examined federal data on the virus last summer, it found that Black and Latino people have disproportionately harmed by COVID-19 vaccine in a widespread manner that spans the country and persists across state lines and regions in urban, suburban, and rural areas, and across all age groups. We've seen the pandemic's devastation here in the Bronx, where predominantly Black and brown neighborhoods have reported some of the highest positivity rates in the city and seen a greater share of deaths. At the same time, data suggests that some hard-hit parts of the borough have among the lowest COVID-19 vaccination rates in the city. For example, 20% of adults in the Lenox Hill, Upper East Side area have been vaccinated, but just 3% in Hunts Point and Soundview were vaccinated. In a recent op-ed, Dr. Torian Easterlin, the New York City Department of Health first Deputy Commissioner and Chief Equity Officer, wrote that for any vaccination program to succeed, there is one essential element: people's trust in the vaccine and the institution that administers it. Yet we know, just as Dr. Easterlin explains, that after decades of racist disinvestment and medical mistreatment, that trust is often lacking among people of color, and vaccine hesitancy among Black and brown communities is higher than any other groups. This afternoon, we turn to voices our college and Bronx community give value and credence to as we delve into this frequently asked question about COVID-19 vaccine and dismantle myths and misinformation that have hurt us. And for the record, I've received my vaccination shot and I expected to get my second one on this Saturday. Now, before I begin, before we introduce our panel, a few housekeeping notes. As I mentioned, this forum marks the start of a larger campaign, and I encourage you to check lehman.edu/vaccine for more details. We will also be dedicating part of our conversation today to audience Q&A, and we'll try to include as many questions as we can. You can also join this discussion online with the hashtag Lehman Gets the Vax. Next, I'd like to introduce our moderator for this discussion. Sandra E Garcia is a reporter with the New York Times. She is also an alum of Lehman College Multilingual Journalism Program. She continued her education at Columbia Journalism School before starting at the Times in 2013, where she writes about race and culture. Sandra, welcome.
Thank you so much for that introduction, and hello everyone, and welcome to Lehman Gets the Vax. I know many of you have a lot of questions about the vaccine, There's new information and new science, new guidances that are released almost every day about COVID-19 and the vaccine. It's tough to keep up with what is safe and what comes with risk. And that's what we're going to try to discuss and decipher a little bit for you today. We will have 15 minutes for a Q&A at the end of the hour, where we'll be taking your questions. I ask that you reserve your questions for that time. We also received some questions from the audience beforehand, so thank you for those. The event is also being live tweeted on Lehman's Twitter channel. You can follow or participate in that conversation at hashtag Lehman Gets the Vax, that's VAX. As Dean Harrison noted, I'm a proud alumna of Lehman's multilingual journalism program. And joining us today is fellow alumna of Lehman College, Sandra Lindsay, Director of Critical Care at Long Island Jewish Medical Center and the first known US citizen to receive the vaccine in a non-trial setting. Dr. Catherine Alicia Georges also joins us today. The professor and chair in the Lehman College Department of Nursing has been recognized as a living legend by the American Academy of Nursing and heads this hallowed program of nursing in the Bronx, the students of which have been serving the Bronx and New York City on the front lines of this pandemic. We also have two scientists on the panel. One, you know, Dr. Daniel Lemons, primarily as the president of Lehman College. President Lemons is also a renowned biologist, a professor emeritus at City College, where he specialized in cardiovascular and comparative physiology. The big stuff, the good stuff. Also, Dr. Maria-Isabel Roldós-Prosser, an associate professor at Health Services Administration at Lehman College and the director of the CUNY Institute of Health Equity. Let's get started. So I'd like to begin with a question that I have read on social media, and I know that there's hesitation out there because of this. The vaccine came together pretty quickly, and many people doubt it or are hesitating to get vaccinated because it came together so quickly. So can you guys explain to us sort of like the process of this vaccine coming together and why it is still safe? I'm going to go ahead with Sandra.
So first of all, thank you very much for having me. It's nice to come back home to Lehman. I had a great experience there, and it is my pleasure to share with my fellow students and alum about my experiences as I've been working on the front lines, taking care of COVID patients along with my team. So I understand the hesitancy about how it came together so quickly. And I'm going to also let the scientists weigh in on the science behind it. However, I know that typically vaccines take years to be developed because, you know, these weakened form of the viruses are grown in the lab, etc. But in this technology, your body actually acts as the factory, where you're inoculated with this mRNA, and your cells then decode this, whatever that code is that the vaccine brings to you, and your body develops the proteins itself, along with your immune system. The proteins that you develop kind of mimic or look like the spikes that you see on that coronavirus. And your body develops an immunity to it to then fight off if you get infected with the real virus, that your body will fight it off. So that alone takes away a lot of the years that would have been spent developing a weakened form of the virus, say in a laboratory. Now your body's acting as that laboratory. Also, you know, the science is the science, right? But a lot of what goes into putting a vaccine to market is funding as well, and just a lot of the logistics to getting it to market. In this crisis, things that used to take years took months. Things that used to take months take weeks. Things that used to take weeks took days and hours, because the world was behind this. So many resources were put into it, and rightly so. We're in a pandemic, we're in a crisis, and we need to preserve life.
Thank you. Dr. Lemons?
Sure. I think that was such a great explanation, Sandra. Thank you for that. One of the things I was actually just discussing with my wife this morning about the development of these new vaccines, the Pfizer and the Moderna, which, as Sandra just is explaining, use mRNA, is that that's new technology, but that didn't happen overnight. That's been in development for a very long time. And one of the examples of, I think, what's so important about having a strong scientific research enterprise that is broadly looking at many things is when the war on cancer was begun, and this was many, many years ago, decades ago, when Nixon was president. The thinking was that cancer was probably mostly the result of viruses. And so a huge amount of that work was spent studying viruses. And then guess what? Most cancers turned out aren't traceable to a viral infection. There are a few like HPV and others that do, but most aren't. But then along came AIDS, and all that research that was done supposedly to look at causes for cancer became extremely useful in addressing AIDS and HIV. So I think it's very similar to what's happening now with these new vaccines that we have. There's been a huge amount of research that's been done, and Moderna as a company was in the forefront of that. And actually, they've never had a vaccine on the market until now, but they've been working on this for many years. So that's just kind of something that says how important it is that we support broad-based research, even though we don't always know what the results will be and what disease they might actually address. And then with the one of the misconceptions, and that's already been mentioned, that I think is really important to address about these two vaccines. Now we know that there's another vaccine, Johnson & Johnson, that's probably going to be approved very soon, which doesn't use the same approach. But these two from Moderna and Pfizer that use mRNAs, there was a lot of concern. In fact, my own sister about 4 or 5 months ago sent me an email with a link, and she said, these viruses, these vaccines are very scary because they change your DNA. And that's one of the misconceptions been actively promoted, which of course is not true at all. These mRNAs are not DNA. They do not become part of what we call the germ cell line. They can't be replicated in cell replication. They simply allow the cells where those mRNAs are able to get to in the muscle, really where it's injected, to produce those proteins that Sandra referred to. So it doesn't change your genetic material in any way. And I just think it's really important to get that out there, because I know that that's a misconception that is still widely being listened to. And it's so important because, of course, that does sound very scary. Something like that would be very scary.
Right. Thank you, Dr. Lemons. Another, I guess, reason for many to hesitate to get vaccinated is the history, right? Especially Black and Brown people. We have been subjected to many medical trials and you name it without our consent. And, historically, that's just what it has been. And so many people are afraid that there could be an instance of that now. What would be your advice to these people? And feel free to answer whoever would like to take the question.
This is Alicia Georges, and I think Dean Harrison in her introduction talked about the history of discriminatory practices and the history of mistrust in this country. And you, Sandra Garcia, has clearly identified that. One of the issues that we must address in this nation is the chronicity of racism. And it is racism that has permeated our society. And because of the discriminatory and practices and mistrust that emerge from that chronic and now public health disease called racism, many marginalized communities are hesitant and are mistrustful. But one of the things as a nurse and being in community for all these years is that our communities will respond, and I think as they did with Sandra Lindsay, seeing somebody like her getting the vaccine, talking about the science, talking about what it means. And I think we need to be very clear in our communities, and I can only speak for African and Caribbean and American communities, that it is our survival that's going to be critical. When 1 out of 4 people getting the coronavirus are Black, you got to be very, very clear that we are talking about survival. And we need to keep talking and talking and talking to people and using role models like Sandra Lindsay and those of us who have been vaccinated and can get back into our communities and talk about the benefits of vaccination.
If I can add to Dr. George's comment, I think that it's also important that communities need to recognize that the disease is fought in the neighborhoods, not in the healthcare system. We need to have a very strong message that the disease needs to be fought in the neighborhoods where they live, where we live, that it's not only an individual decision, but that our individual decision affects our family, our friends, and our neighbors, and our community as such. So putting back the message that the coronavirus and many other diseases that are out there that are not infectious are actually fought in our neighborhoods because of all the determinants that actually determine that why we can get sick. So that is one thing that I think is critically important to people to understand, that we don't want us to get, focus all our attention on the healthcare model, that we have to focus on the community aspect. And the other thing that I think is also important is to break down this idea that the vaccine is something that you believe in. It's not a belief system. I can believe in the tooth fairy, and that is my choice, right? But the vaccine is science. We let our children use vaccines, and some of them may or may not have an effect. I have 3 kids. Sometimes one of them got a fever, another one didn't. And we let our parents and our older adults get the shingles vaccine, and we believe in that science. So I think that we also need to really be very strong in saying, science is not a belief system. It's the closest that we will get to a fact, give and take the scientific process. And that is a strong message of saying what Dr. George said, is that we need to trust that the scientific process has gone through the steps of having something that is safe. And to that end, I think Sandra said something very important, which is that there's no corners that have been cut for the vaccine to be the market. What happened is that all those years, as a scientist myself, we go years trying to find a funder. We go years trying to do the right recruitment and IRB approvals. There's just like so many steps that delay the process. But in this case, we had recruitment, which was almost immediate and voluntary, right? So we said the recruitment time that a scientist would take to recruit patients into our trials or to our studies was cut dramatically. All the time that a scientist would spend writing grants, sending it to reviewers, then coming back with thousands of observations and hundreds of pages to review, and then you write it again and you send it. All those delays were not present in this time. So yes, science takes time, but in this case, it was a unique moment in history, I would say, where everybody came to the table with their best game and said, this is the best science that we have. These are the top people in our fields. Let's try to find something as soon as possible because it's such an urgent matter. So it is very important that we understand that no corner has been cut for the vaccine to hit market.
Right.
Thank you so much. I think both points are really relevant. You said some, just things that people need to bring home, and just to reiterate that, I am a minority. I understand all the historical events that have happened, all the inhumane practices, all the harm. But I also know that since some of those studies, and most people, when you speak about this, will mention the Tuskegee studies. Since then, so many safeguards have been put into place to ensure that we don't have these harmful, inhumane practices again. I know that I am doing research at the moment, and it's very low risk, but I had to go through extensive training to ensure that I know how to properly treat my participants to make sure that no harm is done. This is our best defense forward. This is our best defense forward. We have no path forward. In the smallpox era, it was a vaccination that helped us out of that dark era. This is our best defense at preventing our entire population, but particularly those that are hesitant to take the vaccine. And those are the people that have been so disproportionately affected. So our time to act is right now.
The other thing that I think is also important is to mention that in terms of what is efficacy and the science behind the efficacy of the treatments, we have better science backing the vaccination than better science of the treatment. Once those patients actually get to the clinician or get to the hospital bed, there's stronger science that the preventive measure is more effective. And in fact, from the public health point of view, there's no strategy or mechanism more powerful than vaccination for prevention. But what is more difficult and more uncertain, if you may, is once they get to the bed. Because once they get to the bed, many things could happen. A patient can go in any direction, and the complications that can come from just being hospitalized are actually more uncertain. So if we had to put this in a trajectory, if you may, of uncertainty, this should be in the green side, and the hospital should be in the red, because that's where more uncertainty will occur.
Absolutely. And just before you go, Dr. Harrison, when they come to us, we throw everything, all these interventions, because we don't know what will work and what won't work. And what we've been seeing is a lot of times it's not working. And this causes us to be so distressed. We go through moral distress because we feel like we've given everything and nothing is working. So yes, the science behind the vaccine is shows more effectiveness than when you actually come to the hospital. And you don't want to end up in one of my ICU beds.
Correct.
So, I was only supposed to do the introduction, but I cannot, help but to join this conversation. Given that, I'm a respiratory therapist as a practitioner, and given that I have actually, worked in a lot of our communities, it is so much better when we actually look at prevention. Someone said it very well. Prevention is really your best medicine. While unfortunately, our U.S. healthcare delivery system is actually based on a clinical model that, it's disease, disease treatment. It's a treatment plan. But when it comes down to having communities understand that vaccines, and that's why vaccines are very important, and we have a lot of history of vaccine being very, very able to save a large swath of community. What is so important about this particular vaccine is that it's hurting our area. There are 14 million African Americans in this United States. We don't need to lose any of us at all. And I think that this vaccine makes a huge dent, because we also know that a lot of African Americans and people of color have a lot of comorbidity or other diseases that go along with some of the things that they have struggled with over the course of years, which is why when they come to the hospital with you, Sandra, they don't do well. It's not always, I mean, it's just the vaccine or the coronavirus is one thing, but it then attaches itself to kidney failure or, you know, some problems with your heart. And so if you already are suffering from those, and then you become infected by this condition, it really makes things even worse. And so our message really is, we want you not to go into the hospital. So it's better to prevent any problems of going into the hospital rather than to be hesitant about going into the hospital. And that I think is really a message that we really want everybody to really understand. Thank you. I wanted to say.
And the other thing, Dean Harrison and panelists, that we don't address, but we must address at this point in this country, is the cost of caring for the COVID-19 patient in places like Sandra Lindsay runs is extremely expensive and a burden on the economy of this country. It is a burden when we're losing people who cannot be in the workforce. It's a burden to society when families lose their breadwinner in the system, when families lose their loved ones. And the cost of the vaccine is nothing in comparison with the cost of care and the long-term effects on society of the loss of some of the most critical and brilliant people and people who could contribute to society. So that's why people need to get the facts about the vax, so that they know that it's not just today, but it's long-term.
Absolutely.
Absolutely.
Thank you, all of you. Those were very insightful responses. One thing I think it's extremely important to talk about are the comorbidities in our communities and how, you know, a vaccination, you circumvent getting the comorbidities to then affect you if you do have COVID-19 or coronavirus. And so my question is, well, you sort of answered that already, Ms. Georges, but would it be for someone that is hesitant to take the vaccine and is dealing with diabetes, is dealing with asthma, which the Bronx has so much of, and they're also afraid to getting vaccinated, what would you tell them?
So I'll jump in here and answer that. I personally would tell them that they really should get the vaccine. I think the vaccine is going to be really helpful because, you know, asthma and diabetes or chronic conditions that, you know, over time you have to manage those things. One of the things that I know as a practicing therapist is that the one thing I would always want to do is to prevent my patients from actually going into the hospital. Going into the hospital is probably the worst thing in the world for an asthmatic patient, but you have to understand what are the triggers that are sending that patient into the hospital. It's the same thing with diabetic patients. And I don't want to, you know, that's the diagnosis, you know, it's not the patient is not diabetic, but the patient has diabetes. And a lot of it has environmental impacts. You know, what is happening in our neighborhoods that are preventing people from getting the best kind of food or the most nutritious food that really is good for their bodies, right? A lot of the patients that we see just don't have that abilities to have that, and therefore it just makes the problem worse. So prevention, again, I'm going to always kind of drill that into, you know, into what I believe. And that is, if we are able to prevent patients or clients or participants to be able to, ward off going into the facility, into any healthcare facility. That's actually the best of both worlds. There is, at least the last research that I've done, which has been pretty much, there is not really a permanent cure for asthma, but you certainly can manage. And there are lots of people that have asthma or have had asthma, but have had no asthma symptoms. And that's because they have done a really good job of managing. That goes back to my saying about prevention. If you are able to prevent triggers, then you really are going to be in the best shape to be your best healthy self. And that really is one of the things I think is, and I would always encourage people that have any of these chronic conditions to really become vaccinated.
Mhm.
I think also for both Sandra's and the rest of the panel, that as my colleagues in medicine, and Sandra Lindsay would appreciate it, as we talk as colleagues in medicine and nursing, that one of the most critical things is to get across to people with comorbidities. At first, they gotta manage that comorbidity.
Right.
That's number one, because then that puts them at increased risk for the disease, for the infection to bombard their system. The second thing is that the relationship between the practitioners and the patient and the community is most critical. And I have seen, and I'm sure Sandra Lindsay has seen in her work, that the influence of the primary practitioner, whether it's a nurse or the physician or the PA, is how much they talk to those patients that they have in how to manage what's going on with their chronic illness. And it is that relationship, Sandra Garcia, that's built up between practitioner and patient, practitioner and communities that will determine whether or not people are going to go ahead and do as Sandra Lindsay has been saying, and all the things I've seen her say, you got to get the vaccine, trust the science. And I take from that, she's saying, trust your practitioners who are out here helping you.
If I can add another angle to that as well, and I'm piggybacking on Dr. George's response here, is that sometimes I feel like I'm Hispanic, right? And it's pretty obvious by my name. My first name is Maria. And is that sometimes I feel a little bit uncomfortable that communities such as Hispanics and African Americans and other minorities are put in like this bad light of saying, this is the communities that are being the most hit. I hear this over and over and over, but my positive self always tells me, why can this community actually turn around and say, this is the community that is the most vaccinated, right? Because at the end of the day, we are both more frequent in both sides of the equation, as patients and as healthcare providers or nurses or PAs. We're in both sides. So I wish, like in my hopeful self, my very hopeful person that I am, I would say, I would love to hear in the news more and more that the community that is getting the highest uptake of the vaccine is the community that we're talking about, because we're in both sides of the equation. We're the most affected and we're most of the workforce. In addition, with both those things combined in my mind, and my research mind tells me this is the perfect storm for us, for this storm to hit the news. That's the first thing. And the other thing is that sometimes those that are more hesitant, and I include my mother in this group, they need to hear the message often, and more than one time. I told my mom to the point where I almost abused her. that she needed to get the vaccine. Like it was so like, mom. And finally, who got to her were her sisters. Were the sisters among her age group. And I remember that story, and I'm sharing that story because I think it's important that our communities cannot be, in our communities or any person, I'm just going to say, that is hearing a message to do something, they need to hear it in a positive tone, and it also needs to hear it often. It doesn't happen with one time. this is repetition, So it may be, and I see there's 100 people in this forum. I wish that this becomes 100 advocates. And those 100 advocates, become and touches another person, and that's 200 and what have you. And we can have a multiplier effect. But I think that is the message that I have to the communities that at least I represent, and the reason I'm in this panel. I'm a health disparities researcher, and this is what we need to hear. And this is what I know of the communities that I represent, is that communities is important. The sense of community and the sense of value in community, sometimes in this asymmetry of information that we have experienced through history, where a physician that is receiving care doesn't look like me, then I have hesitancy. Right, but now those gaps have been shortened thanks to the work of many of the leaders that are in this panel, that have been working on reducing this gap. And then we're at a point in history where we actually can put into action all those years of reducing the gaps in the biomedical workforce, of having a more diverse biomedical workforce. So I think that today we probably still have that gap. I'm not going to say it's resolved, because it's not the case. But certainly we're closer than the Tuskegee example that we keep saying, and that I hope that people just say we need to understand history, but we also have to recognize that this gap has been reduced, and that now these communities are actually closer together in this transaction.
One of the things that you mentioned, how you wish that the news would, I guess, revert. Well, it's not up to the news, but I guess you want to hear that our communities are, instead of failing at getting vaccinated, that they're succeeding at, record numbers. But one of the things that have stood in the way, and COVID has done this, not just for this, but it has exacerbated all the other issues, right, that we have, that people in our communities are dealing with, whether that's access to the internet to book an appointment, language barrier. My parents speak English just enough, right? There's also the fact that some people from other neighborhoods are booking appointments in underserved communities in order to benefit from that. So how can we move past all of these things that are now, these small things that were just little bits that we understood, right? We understood that our community is underserved in all aspects. But how do we move past those things in order to get our people vaccinated?
I can tell you some things that a number of organizations have been doing, and I'm sure Sandra Lindsay can tell you some more. But one of the things that has been going on, I can speak for the Black nurses across this country. And Black nurses across the country in many of the neighborhoods, as Dr. Roldós says, neighborhoods, have been making the appointments for people who don't have the access to the internet. I'll tell you, I have some older friends, I won't tell you how old I am, but some people who are older than I am, who don't have a smartphone and they don't have the internet. Well, I call them up, give me your number, give me your this, give me your that, and I make the appointments for them. Or I call their children up and say, get on the phone and make the appointment, or get on the, you can scream at people when you know their children. But our chapters in Black nurses have been going in and trying to work with folks. I also sit on a board, and I don't care, I'll say the name, called RAIN here in the Bronx, and we take care of people who are older, are older. And so what we've done is a couple weeks ago, we went into the big, where we have an adult center, and the whole building, we had them come down and they got vaccinated. And anybody who lived on Boston Road could come and get vaccinated. And so spreading and getting deeper into the community. And, I watch a show, and every night they say, take care of yourself and each other. And that's what we need to do. The long time ago that each one of us should reach one. And so those of us who have access and know about the people who don't, that's what we need to do. And organizations across this country are doing it. I know my colleagues in medicine The NMA folks are doing it. They've got their task force. I know Somos is doing it. They're out there, getting folks vaccinated. The sororities and fraternities are out there getting and going to people and making sure. And then we're having the pop-ups, the mobile units. In rural America, one of the big issues are the people over 50, because you do understand that the people over 50 are the 90% of the people who get COVID-19, not you young folks like you, Sandra and Sandra, but the people over 50 who are the ones who are at greatest risk. So they're going deep into taking those mobiles. People are picking people up. Then now we're doing, some of the groups that I belong to are now going into the home to give the vaccination because people can't get them. So there's all different ways we can do it. We just have to upscale it. That's the key. We've got to upscale it. And to do that, we need every one of us, but it's the upscaling. And Dr. Roldós is right. We got to upscale this, though. We got to upscale.
And I do have, and I say again, my positive mind in my hopefulness is coming through here, is that we cannot expect public authorities to have all the ideas. That is a very narrow-minded way of thinking of solutions, that all the solutions are going to come from those decision makers. The most creative ideas come bottom up.
Right.
So exactly what Dr. Georges is alluding to. Sometimes we know our communities more than the public authority, which is probably in a different town, trying to make a decision for my zip code. And the way that I think is the most powerful is when you actually give that power back to those communities. Like I said earlier, the fight of COVID is not fought in the healthcare model, it's fought in those communities, in creating these communities with power, to bring this innovation, because diversity brings innovation. When you have a table that is, as diverse as this panel, then is when creative ideas start to occur. But if you put in this panel and everybody looks the same, they're going to come to the same conclusion. So if you're telling, and I hear Dr. Georges says, like, let's put a mobile truck in every building and say, calm down, you're going to see that those people are going to come down. And then the car is going to go to the next building and do the same, and then within no public authority is going to have the idea of having a mobile car going building to building and vaccinating 1,000 person in 3 hours, because that's how many people will come down the stairs if they know the vaccine is in the parking lot. So I think that it's very important that we kind of recognize and not minimize the individual power that each one of us have to influence a peer, a family, a friend in our community.
Absolutely. I want to thank you all for this really powerful conversation. I think it's important for us to also address some of the questions that are in the chat, because there are quite a number of them, and we want to be respectful of everyone's time. So Sandra, I'll turn it over to you. Sandra Garcia, I'll turn it over to you to get us started on answering some of those.
Great. So from Falashade Olatunde, how did you get the opportunity to be the first person to take the vaccine, Ms. Lindsay? Oh, and what was it like taking the vaccine for the first time? Were you scared or hesitant? Did you have any symptoms?
All right, so I've been an advocate for this vaccine ever since I heard that there was going to be a vaccine in development. I could not wait. So I've been, just openly saying how much I would want the vaccine as soon as it is deemed safe and it hits market. That I have never camped out at any Black Friday shopping or anything like that, any first releases. But I was willing to camp out wherever this vaccine was going to be administered, because I was very scared of getting sick, getting others sick, potentially ending up in one of my ICU beds, even being at home and not being able to work alongside my team taking care of patients. So I made it public that I was willing to take the vaccine. So when I got the call that Sunday evening that the vaccine was coming to New York and to Northwell on the 14th, if I was still willing to take it, I said absolutely. So I feel grateful and lucky to have had that opportunity. If you notice, I didn't even flinch. I was so waiting for that needle to hit my arm. And when Dr. Chester, inoculated me, it was like a huge burden was lifted off my shoulders. I felt so relieved, and the fear that I went into work with every single day was replaced with hope. I had no symptoms beside a sore arm, which is expected after the vaccine. I experienced no fever, no chills, no headaches. In the summer of 2020, I took the shingles vaccine, and that knocked me out on both occasions. With this vaccine, I had no symptoms at all.
Can the vaccine cause COVID-19? This goes to anyone.
Respond to that. So the answer is no, it cannot. And I think this goes back to, what we've discussed earlier is the way the vaccine works. It's not a virus. It's not even more than just a small fraction of the total virus. It's a little bit of the protein that sticks out that finally gets generated in your body and that your immune system responds to. So there isn't any way possibly that you could get COVID-19. There's a 0% chance of that.
Thank you. Does the COVID-19 vaccine cause any side effects?
I can give a little, a different example to what Sandra just gave in my own experience, because I've had both vaccination shots now. And the first one, I got a sore arm. And the next one, I got a little bit of a sore arm, but the next day I also pretty much slept the whole day. I didn't have a big headache. I didn't have a fever. I didn't have chills, but I just really didn't feel like doing very much. So that's how it worked for me.
Me too.
And
Me
some
too,
of my
Dr.
colleagues,
Lemons. Mhm.
some of my colleagues reported that as well, Dr. Lemons, just feeling tired, but they just welcome that opportunity to get some extra sleep, drink a lot of fluids. I have been going nonstop. I have not taken any vacation or any time off or anything. So I would have gotten some extra sleep had I have those symptoms.
Yeah, I was glad for it.
Yeah.
And I was also happy to know that it was really doing something. I didn't have any doubt about it.
Well, I can tell you that I got my first one, and after that, I ran 10 kilometers, and I was fine.
Great.
Good. Do people still need to wear a mask after vaccination?
Very much so. You need to listen to the CDC recommendations. And if you also listen to Dr. Fauci, you will note that he had also said that we should all continue to wear 2 masks, whether a surgical underneath and a cloth, or I wear 2 surgicals and a fancy one, depending on what color I have on, and which I think many women do. But and people like Sandra wears her N95, and our students wear their N95, and I have my N95. But we must continue to not just only wear masks, socially distance, wash our hands, and do all the things that we did prior to getting the vaccine.
Great. If someone had COVID-19 antibodies or recovered from COVID-19, can they get vaccinated?
The recommendation, I think, is kind of still not firm on that, right? I mean, that's my understanding. I think there is a suggestion that I've read that possibly those who've tested positive or had it would get maybe 1 vaccination, but I don't think, maybe some of the others on the panel know something more recent, but I don't think that it's really clear yet what's going to happen.
One of the physicians in a panel I was on the other night, and he's an infectious disease person, says that there is, as you say, Dr. Lemons, some emerging discussion. But I'm sure Sandra Lindsay will tell us, I don't know what they're doing at Northwell, but they're still saying, and he said, take the vaccine.
Yeah, the
Take
recommendation is to take the vaccine. I've had Some of my employees who had COVID before had antibodies, tested positive for antibodies, and at different stages, they lost those antibodies. So it's unclear whether or not your own natural antibodies from getting COVID, how long they last. People lost them after 1 month, 3 months, 6 months. So the recommendation is to take the vaccine.
Thank you. Would the vaccine eventually be required in order to enter a campus?
That's Dr. Lemons.
I guess that's a question for me, isn't it? You know, we don't know yet for sure, and part of what will determine this will be what New York State Department of Health decides to recommend or to mandate. But the one thing that I think the situation we're in right now with regard to coming to campus is that we have approval for these vaccines under an emergency category, right? These are approved because of the pandemic. None of them have full FDA approval, which they wouldn't have, right, until they have been in use for some time. And that approval may not be that far away. From what I understand, it's possible that approval would come really within the next few months. I think if at the time that the vaccines are fully approved, it's much more likely that it will be mandated, just like the other vaccines that are mandated now for students who come to campus. So I think that's very possible, but right now it's not a mandate.
Thank you. How often will we have to get the vaccine? Any known long-term side effects?
I've been reading, and again, with my colleagues who have been writing about some of and again, you have to remember the N. How many people, right, Sandra Lindsay? How many people are we talking about who may have some long-term effects? They don't know for sure. They're seeing some things unraveling and evolving, and it will take time before they will be able to say anything about that. About getting more, we don't know. There's questions. If you read the same New York Times, Sandra Garcia that I read, and you've listened to the news, there is some discussion with the pharmaceutical companies about whether or not we're going to need boosters, or about whether or not some of us will need a third shot. Today, my colleague is sitting as an external reviewer on the Johnson & Johnson. They don't know till that's all done what they're going to come up with. We know that's one shot. We don't know what's going to happen. But the other thing, and I'm sure Dr. Lemons can talk more about it, is there is the emergent variants that are occurring, and nobody knows for sure. They think that what we now have may be effective. How effective and over what period of time, the data are not yet in. We have got to go back and trust the science. They're working on it. They're looking, they're thinking they will be able to do this. And there are some studies that have emerged, particularly in Europe, that seems to say that some of what they have on market there can capture any variant. But let me just warn you, New York City folks, we gotta be careful. A variant is here in New York City, and we've got to monitor, and therefore what's going on. That's why everybody needs to go out and get vaccinated when their time comes, because at least we'll have some protection at this point in time.
But I do want to make a point, I think, because I don't want to, we understand that a lot of the data is still to come in, that we don't want to put a shadow over the effectiveness of what we have in place right now. In that we have to be understanding that the situation that we're in is unprecedented. So it is normal and is expected for protocols to adapt as we get to the next stage of the management. Like we would normally do in any type of care. There's different stages of how to do the management. So the protocol that we have in place currently is what we know, and it's the guidance that has been, supported by the science of the trials that we have spoken about. But there is not, if there is a change in this protocol, that does not mean that what was before was wrong. Because I think that a lot of people are thinking that the definitions that are coming have to be definitive. Like there's only one solution for this problem. And the answer is no. There is more than one solution, and actually the solutions can actually change without that being that what we did before was wrong. Is that we're learning in this process, and that nobody designs an experiment to fail. We all design experiments for them to succeed. That's the whole purpose of science. So if there's changes in the protocol in the next month, that doesn't mean that, oh, they just changed it so they were wrong before. They were, we are making the best decisions possible with the information that we had at this moment in time. And that protocol has science behind it. And if there's a change in the next month, in the 6 months, in the next year, that would be based on the information that we have. It doesn't mean that what we did before was wrong.
I think that's such a great point you're making. You remember Dr. Fauci was criticized a number of times because, people would say, who wanted to be critical, well, you said this at the beginning and now you're saying that. That is the way the science works. The science evolves. It keeps taking in more information, and the more we learn, the more confident we are that we figured out certain things, but we always learn more, and it will change. And one of the things that I think that it's very important to keep the big picture in mind. Right now, over 28 million Americans have been found to be positive. We know more than that number have actually been infected, but 28 million have been found to be positive. And we know that over 500,000 Americans have died. That's very clear. We know that about 45 million Americans have now been at least had one vaccination shot. And when that was studied, the most recent data I've seen was done when there were about 14 million people vaccinated. And there were a few thousand reactions that people had, then about 10% of those were deemed to be serious reactions. There have been a few deaths that might be attributed to it, but if you think about it, out of 44 million, maybe there have been a few serious reactions, but out of 28 million infections, 500,000 people have died. I know which group I want to be in. I want to be in that vaccinated group. I'm going to take those odds.
If you have been vaccinated, can you still transmit the virus to others?
Dr. Lemons, I don't know if you're going to answer that, but I was again in another webinar with, again, some infectious disease folk. And what they said is they don't know if you may have, if you are symptomatic or you are asymptomatic. You may be carrying, and I see Sandra Lindsay shaking her head, you may be carrying the virus. That is why you got to keep masks. You have to do social distancing, and you have to adhere to the CDC guidelines, because they're not sure. As Dr. Roldós says, everything's emerging. And so the protocol today may change 6 and 8 months. But right now, you need to adhere to the guidelines, because there is a possibility that it can occur.
And one thing I like to say is that the vaccine protects you. It doesn't necessarily protect other people. It's kind of the reverse of a mask, right? A mask is more protective of others, although it does protect you. But one of the things, there are 2 studies that came out just in the last week. One was from England. I can't remember where the other one was. And they found that after the first vaccination, the protection from getting COVID was about in the mid 70%. After the second vaccination, it was 85 or higher percent. This is with the Pfizer vaccine. But they also found that actually the viral transmission was also reduced after the first. It was also in that range, 65 to 70%. And after the second vaccination, it was also reduced. That is, the ability to transmit virus was reduced by about 85 to 90%. So those studies are showing that it may not completely prevent you from infecting someone else or having some viral load, very small, but it definitely is effective. It's reducing a great deal. And we know that the chance of getting infected is related to the dose that you're exposed to, how much you're exposed to. And so if you get the dose way down, then that vaccinated person really is much less likely to transmit the virus to someone else.
So, and if you
Still
think
gonna
about,
wear a mask.
exactly. So I was going to say, like, if you even think about this, like if we have to have like a graphic, aid, of how we would put this, we have different types of ammunition for the vaccine. We have the masks, washing our hands, the social distancing. This is an additional ammunition that we have. If they're all combined, our chances of protecting ourselves and our family is even greater. So let's just include it in our toolkit, in our toolbox of ammunition to fight the virus. They're not mutually exclusive. If anything, it's a multiplicative effect to do what we want, and is to reach that herd immunity. And we haven't talked about a lot about that in this panel, but I think it's worth mentioning that we want to get over that 70-80%. And just think about this when you look around in your family, in your community, and if you see 10 people, you should start counting and saying 8 of these 10 hopefully are vaccinated, and in addition are doing all these other things, so that we can actually get back to the new normal that we have created for ourselves, that we can live healthier lives.
Thank you. What is the recommendation for international traveling after being fully vaccinated? Also, is a blood test recommended after vaccination to check for antibodies?
I mean, I can speak about, just because of my desire to do international travel, maybe. Of what I've seen, and, family members and family that live abroad, that comes down to the authorities of the country that is receiving that passenger. That those guidelines are changing, and different countries have different rules. Some countries in Europe are more strict and are saying, when you arrive, this is what you have to comply with, regardless of you've been vaccinated or not vaccinated. And some others are less lenient. And the same goes for the other way around. If in international travels coming to the US, they have to, follow the guidelines, but then the enforcement is very, very loose. And I think that's one of the problems that we have with international travel, is that the enforcement once you arrive to the United States is very loose, which again brings us to the point of this panel, is that we have to do our best to create that immunity where we are, because then if we get that 20% of people coming in and coming out, we need to make sure that our communities are being protected, and that our immunity is resistant to maybe these international travels who may not actually be adhering to what they're supposed to be doing. So it could go both ways, in my opinion.
And also the airlines are also very responsible. I come from even though it says the United States Virgin Islands, we're still considered international when there's travel. And so you cannot get on a flight going into St. Thomas or St. Croix unless you have a negative COVID test. And they will stop you. My daughter and my grandson were there 2 weeks ago. They could not even get on until their test was put into the computer and on Delta Airlines for them to get to the Virgin Islands. Once they got to the Virgin Islands, they were again checked, the manifest, the airline double checked, because the government of the Virgin Islands, the health department folks were right there. And so again, they were being much more vigilant because they're very small. And as Dr. Roldós says, other parts of the world are not as good. But I think we do have some barriers that we've been able to put up. And they'll start with the airlines. Because if we don't have wings, so we can't fly. So we got to get where we're going with some carrier. And those carriers have a public health responsibility. And I think that's what CDC was very clear about. They have a public health responsibility to do something about making sure that people who are infected are not coming or going back and forth?
Will the vaccine become mandatory?
I wish it would. Particularly, and I'm going to speak on a different hat that I have. You know, 40% of the people who died in this country died in nursing homes. All right. And when you are seeing a lot of this hesitancy and this problem, is some of these folks in these places, and I hate to talk about nurses, right, Sandra? We hate to talk about our colleagues, are refusing to take the vaccine. And they're placing folks who are already fragile and frail in jeopardy. So I personally, I can't speak for nobody but Catherine Alicia Georges. I think it should be mandatory.
How do you address people who do not believe in the vaccine from a healthcare and personal standpoint?
Sandra can answer that.
Yes, Ms. Lindsay.
So when people speak to me about hesitancy, I always want to know why. Like, why are people hesitant? I think that's the first thing. As a nurse, you do your assessment, right, Dr. Georges?
Yes, ma'am.
And then you address it from there. If it's inaccurate information or misconspiracy theories, then you can debunk that with facts. If they're quoting historical events that have passed, I think it's important to acknowledge that, yes, those things have happened, but look at how far we have advanced with the science. And again, to show people facts. If they are scared because of the needle or because of the side effects, then again, you share your experiences with people. And you know, you just have to keep giving the facts. As one of my colleagues said before, you speak over and over and over and over again and continue to educate people and educate in a way that people understand. No sense telling people about, you know, using words or phrases that people don't understand. You have to meet the learner at where they are. So it's continuing to speak about it, having forums like these, so that people can come forward and have their questions answered.
I do think that it's also important to say that those that are in the healthcare side of this, if I may say, for me, are scientists too, you know, and I think that we need to remind our colleagues in the healthcare side, those science background that they have in their education and in their practice. And that every day that they go to work, they're doing applications of things that have gone through the scientific model, from, you know, the basic science to the translational of interventions or what have you. And so that reminder of saying like, well, you are actually someone that has the opportunity to implement the science that you believe in, because you're a scientist too. You're a nurse, you're a PA, you're a physician. So that some of this community can maybe more resistant is bringing them back to their to the data and to that, you know, the understanding that they have about the implementations or the interventions that they do every day in their care, which is a different message that you would have with a community or with a family member, where those facts maybe are not necessarily what they want to hear. What they want to hear is something more related with what we spoke about in this panel, which we've reiterated many times.
I actually like that question, so I'm going to save it for last. Since COVID is a virus and there are now vaccinations, do you have to be vaccinated yearly, like with the flu vaccine?
I don't think we know. I think this is one of those places where we're going to be learning. And, you know, we've talked about variants. And by the way, I read yesterday, there's a new variant that's arisen in New York. It's not the same as the one in England. It's not the same as the one in South Africa or others. And at Columbia Presbyterian, where this study came out, they were picking up 30% of the current samples had that variant. Yeah. So that's it's relevant to this question just because as the variants come out, I think it's very likely that there will be boosters that will be tuned to the dominant forms of the variants that, that could be needed, just because you want to have the most effective immune response you can.
Thank you. And finally, what would new normal look like if everyone is vaccinated?
Hugging, touching, seeing grandchildren, having dinner in a restaurant, getting on a plane without my shield, a N95 mask, maybe a plain old surgical mask, but, being able, like Dr. Roldós said, doing this is the first time in years that I have not been in some country outside of the United States, and maybe it'll be back to, and I think, and I'm not being facetious, but I think it will mean family life and family connections and reconnections can reoccur. That to me is most critical. Somebody at my alumni said, what would you do with the new normal? I said, I'll get to hug people that I really care about. And that to me is the most important.
I agree. So much creativity, despite all the devastation, have come out of, just dealing with this virus. People are resilient. I think that we will build back stronger as a community. And I am from the Caribbean and used to having dinners together and Sunday dinner together. And we had one TV. I know we're probably not going back there, but we had one TV and the family came together and enjoyed just some invaluable family time. And, again, despite the devastation, it's been nice to see how families have reconnected, taking walks together, sitting on their stoops, having dinner together. And I hope that will continue because that is important.
That concludes our discussion. I want to thank everyone, Ms. Lindsay, President Lemons, Dr. Georges, Dr. Roldós, for a remarkable and very enlightening event. For more Vax Facts,